Congratulations on making it all the way to full term. My name is Dr. Teresa Johnson, and I am one of 6 obstetricians at Carteret Ob-Gyn Associates. If you are watching this video, it means that you are at or past 37 weeks and 0 days in your pregnancy. That is considered full term. That means from this point forward, your baby will be considered full term when born. You have likely been preparing for this point in your pregnancy. You should have already obtained a car seat. You should also have a bag packed and ready to go to the hospital. In addition to these things, we want you to begin thinking about how you're going to feed your baby. There are many proven benefits to breastfeeding for you and your baby. We encourage you to breastfeed your infant. The nurses at Carteret General Hospital have had training specifically to help new moms breastfeed their infant. There is even a program to help you with breastfeeding after you leave the hospital. Information regarding this program will be available to you once you deliver. While we would like to encourage you to breastfeed your infant, please know that all of us at Carteret OB-GYN will support you whether you decide to breastfeed or formula feed your infant. If you took the birthing class at Carteret General Hospital, then you probably have already had a tour of labor and delivery. If you didn't take the class and are interested in a tour of the facility, you can call Labor and Delivery at Carteret General Hospital. If the nurses on the Labor and Delivery unit can accommodate you, they will take you on a tour of the unit. Please call ahead, because sometimes they are too busy with laboring patients to be able to take you around. As you near the time you will go into labor, we'd like for you to start paying attention to your contractions. Some of you will have felt contractions at this point in the pregnancy, and some of you will not. You can sometimes feel a contraction with your hands. If you feel your upper belly getting hard and it's hard to press your fingertips in, this is a contraction. Some people describe them as feeling like period cramps, or that the baby is balling up. Some people feel them as a strong abdominal cramp or lower back pain. When timing contractions, we want you to start timing from the beginning of one contraction to the beginning of the next. The amount of time between them is how far apart your contractions are. If you find you're having contractions every 5 minutes or less for an hour, please come to Carteret General Hospital. You do not need to call ahead of time to let us know you are coming. Labor and delivery nurses are available at all hours to help determine if you are laboring. Go in through the emergency room entrance, and they will take you to labor and delivery to be evaluated. You will be brought to labor and delivery triage room, where you and your baby will be monitored and observed. If you are found to be contracting often and your cervix is changing, you may be admitted for labor. If you are not laboring, you will be discharged home. If you think your water has broken or you are bleeding like a period, we want you to come into Carteret General Hospital immediately for evaluation. Come in through the emergency room and they will bring you directly to labor and delivery for evaluation. Many patients want to know what happens if they don't have their baby by their due date. Unless you have a complication of pregnancy, it is best for you and your baby to wait until 41 weeks for labor induction. That is 7 days after your due date. This recommendation is based on the finding that induction with an unfavorable cervix before 41 weeks increases your risk of cesarean delivery. Also, if left alone, most women will spontaneously labor during the week after their due date. If you are still pregnant by 41 weeks, we recommend you undergo an induction. We will discuss the timing with you as your due date approaches. If you are induced after 41 weeks, your risk of cesarean delivery is the same as if you had labor on your own. If you have had a prior cesarean delivery, you likely already have your repeat cesarean delivery date scheduled. In uncomplicated pregnancies, we will typically schedule your repeat cesarean after 39 weeks. There are 6 obstetricians at Carteret Ob-Gyn who deliver babies. Hopefully you have met most of us. If you haven't, please make sure to let the prenatal care scheduler know to make an appointment for you with any of the physicians you haven't met. The delivering physicians at Carteret Ob-Gyn take responsibility for labor and delivery on a rotating basis. When you go into labor, one of the 6 of us will be the physician caring for you during your stay on labor and delivery at Carteret General Hospital. After your baby is born, the typical postpartum stay at Carteret General Hospital is between 1 and 2 days for vaginal deliveries and 3 days for a cesarean delivery. Complications at delivery or postpartum will sometimes delay your departure for home. Patients with complications may need to stay a bit longer. We'd like you to begin thinking about the method of birth control you plan to use after your baby is born. If you are going to breastfeed your baby, you can use progestin-only methods, such as progestin-only birth control pills, the Mirena IUD, Nexplanon, or Depo-Provera injections. Other options that are non-hormonal are also compatible with breastfeeding. These include condoms, copper IUD, and tubal ligation. If you do not plan to breastfeed, you can use combination birth control pills, NuvaRing, or any of the previously mentioned progestin-containing or non-hormonal birth control options. Feel free to discuss this with us today or at any of your remaining prenatal appointments. Once again, congratulations on getting to the end of your pregnancy. Like you, we look forward to meeting your new baby.